Hey, Hardin County, I wanted to come and we're going to do a couple videos about the health department. If you've been following along with my other commissioner and summary videos, you are kind of hearing bits and pieces of things here and there, but I wanted to go over and kind of do an overview of what I have found out about the health department. They have their district advisory committee on Wednesday, March 12th, and so that's a big meeting. And so we'll be following this along and, into the future as we watch what is going to come of our health department. What I thought we should do first is go over what is the health department, right? So I have their annual report from 2023. The 24 will come out Wednesday at the district advisory committee, but I didn't want to wait. I wanted to get this information out to you so that you can start seeing what the picture of this health department, what they do, and how they impact our community. Because ultimately, as a community of Hardin County, we need to decide, what we want from our health department, and then make those wishes known to our representatives. So they have, this is of course a little bit old, but we have the Board of Health, and then their hierarchy. I've scribbled all over it, but basically, you have your president, and then there's 6 different people on the board. You have to have a doctor on there. I know we have a doctor and a lawyer and a pharmacy student and a business gentleman now, and so, kind of a well-rounded, and different people appoint them. So the city appoints 3 people. I think the commissioners have a representative on the board, and then the townships would appoint. So kind of who appoints who is, that's how the board's kind of made up. Then you have your hierarchy, which, of course, you have your the DAC, which is the appointing authority, right? So they collectively would appoint a certain number of people. And then you have the Board of Health, and then you have your staff, right? So on staff, we have a commissioner, a health commissioner. Typically you have a director of nursing, you have the environmental health director. Under the environmental health director, you have the sanitarium and a clerk who does all kind of the scheduling. You have a fiscal officer, accreditation coordinator, and an emergency preparedness coordinator, which they would work with the EMA, LEPC. You have the director of nursing, with nurses underneath them, RNs or LPNs, and then a billing clerk, right? So that's kind of the full board. What, about 10 people? Well, depending on how many nurses you have, right? A full board would be like 13 people. Right now we have 6, and they're kind of doing mismatch of jobs as things get smaller. And so, but that's, the general outline. Now, per the ORC, which I think these are the things that we need to talk about collectively, is per the ORC, you need a medical director, a health commissioner, a director of nursing, and a director of environmental services. And that's it, right? And so they do not have to be full-time. They can be part-time, right? A lot of times I'm hearing that the medical director or the health commissioner, they come during the monthly meetings, just because you're in that role and you do get paid for those things. I think the health department board does get paid. That, those directors are kind of coming in and signing off on orders. So in some instances, you have people that are not, they're certified to do maybe, say, inspections, but they have to get the sign off of the environmental director, right? So that director kind of says, okay, here's my signature. I've looked at it, I've reviewed it, and it's, good to go. So as far as, the workload that's required to do it is going to be based on what the needs of the community are. And you can certainly use, different administrative support to do what they can do to take some of the load off of those higher paying positions, right? So you may have a full-time support person and a part-time environmental director or nurse, as long as they're there to sign off what's needed. So kind of looking at, cost and time to get the most out of your department that you need, right? So, certainly going down to a bare bones to save cost is going to be an important thing to look at. Accreditation. Here's another thing. We spend, I think it's like $60,000 to be accredited. In the past, we've had an accreditation coordinator that's all they do. And you have to pay a fee to the state to be accredited, so it's kind of a circular deal where the state says, hey, I want you to be accredited and we're going to charge you these fees. And if you're not accredited, you can't get the grants. And if you can't get the grants, then you can't hire people. And if you can't hire people, you can't apply for the grants. And so it's just a very circular, and, ideally the state can charge you whatever they want and put any restrictions on it that you want that forces you to be accredited. Now, you don't have to be accredited, and teasing out the law in that is kind of the trick, right? So it's like, if we don't spend the money on accreditation, can we sustain our health department? Because a lot of things are paid through grants. So that one's definitely a legal conundrum that, just needs to be worked through. Like, somebody just needs to sit down who's been through this and say yay, nay, or the other. Now, there is talk that if you're not accredited, that you still have to join up with like another county, like Logan County, for their accreditation. So it's very complicated, but it is a huge cost, and we're not in charge of that cost. That's the state's in charge of that cost. So that's one thing, again, that when we're looking at our health department, do we want to pay to have it accredited? What are our legal options there as a community? I talked about, so the servers, you kind of have this IT deal where, the servers died, they had to get new ones, the phones aren't working, the website's not updated, and so we're seeing on a customer side that these things are degraded. I'm just going through kind of their, the line items of their report here. So nursing, which of course I think most people would be interested in, when you talk about a health department, there's a couple different things that are going on that, okay, you have the environmental health and then the nursing, and what is required from the nursing side of it. And it's, like an epidemiologist to track communicable diseases, nurses to cover our mandated TB cases. We are not required to have vaccine clinics. We're not required to do like these extra programs. The extra programs allow you to bring income to support your health department or to get grant money to support your health department, but they're not by law required. There's a whole list of like mandated jobs that have to be done by somebody. Now, it doesn't have to be done by our health department. If you don't have a DON, you can hire out from a, like Logan County or Union County to say, hey, we need a DON to come over 5 hours a week and, do X, Y, and Z. And generally it's like $50 an hour to contract with that. And so would that be cheaper based on our usage than hiring somebody, full-time, part-time, and then you have all the cost of employment? Those are things that need to be kind of weighed and looked at, but you're going to have to dig into how much time is actually being spent on the things that are required by law, and then what do we want. So on their report, they have to report communicable diseases. In 2023, we have, so you can see here, we had 802 COVID-19 deaths, and then 123 STI, let me say that right. 802 COVID cases, not deaths. That would be a lot. So just cases. So they have to log those. And then 123 STIs. And so when you are driving around town and you see certain billboards that may be like, I can't believe that board that is up there. That sign's up there. It may be because it's a big issue in our community because the numbers aren't lying. So just FYI. So anyway, so that's something that we do have to report. We also have, now these are kind of programs that I think we have, it's the kind of thing where the health department can put you in contact with these people, but we've got children with medical handicaps, the CMH program, Cribs for Kids, Family Bike Program, vaccine clinics. Again, those are just extra services that are provided. Do we use those? If anybody had experience with those, give me a call. I'd like to hear from your perspective of you used those programs, what you thought of those programs. They've given 36 lead tests in 23 and 81 tuberculosis tests in 23, which I was surprised. I don't think of tuberculosis, if you got a cold or something that you go, oh, it's TB, but here we are, 81 tests given. They also have hearing and vision clinics, the Ohio Buckles program, which is the car seats that I mentioned in the other video where, they basically give them these car seats. Now the car seats expire. So once you don't use them, then you have to just give them back, but we just have them to use, but there's nobody here to implement the program to hand those out. So, it's kind of, we don't really need them at this point in time. Blood pressure checks. They said 100 car seats were installed and donated in 23. So, but that's back when we had a DON and, the staff to do it. So I'm not sure we'll find out Wednesday what the new numbers are. Samaritans of Hardin County, which are like dental help. So emergency preparedness, we had somebody on staff to do that. The eclipse, grants, a mask fit tester. So I know the fire department and other people, we have a mobile mask fit, where you put your face in it and it measures and does its thing. And so that's pretty fancy and it kind of goes around all of Hardin County. So that's a little bit on emergency preparedness. I don't know that role in the health department and how that overlaps with the EMA LEPC. Do we need it at the health department? Is that something that can be covered by the EMA? I don't know. So that's, more stuff to question. Vital statistics. So this is another one that is mandated by the state that they have to, the health department has to do. So that's birth certificates, death certificates. They're in 23, they were $27. They had 904 birth certificates issued in 23. They had 25 home births, which would include like the Amish and others who are having home births. Death certificates. Let's see, death certificates are only issued in the county in which the death occurred. The total number of death certificates in 23 were 824. Total deaths filed occurring in Hardin County in 23 were 221. Oh, here's something interesting. The leading cause of death in 2023 were heart-related, adult failure to thrive. I'm not familiar with that one. Blunt force trauma, and cancer and other causes. So on this last page here, we have the financials. The revenue that was brought in, again, 23 was $760,789. They have it broken down by like the Board of Health, food service, trailer, and recreation parks. So there are like fees and stuff that come with those. Swimming pool inspections gets a little bit of money. Infrastructure grants, Help Me Grow. So they kind of have money from all different sources kind of coming in, paying that amount. The year-to-date expenses, which would include salaries and such, was $894,651. So pretty close, on that number. Now they did say, so it is interesting. So in 22, now remember, I don't know when the COVID grants ran out. So they had money in 2020 and 21. Wow, they had the whole it was like the ARPA money. What was it called? The CARES Act money, right? There's a huge push of money into the system. It didn't. The thing is, they have all this money and they push it to local government, but it doesn't always go into the right hands. Now, the CARES Act, it was very restricted, like PPE and salaries, incentive pays, and those kinds of things. And so it kind of gets funneled down into the one area while maybe other areas kind of suffer. And so then you come out of that and everything's maybe a little off balance. So we had that money, and then of course then we had the ARPA money, which then went to the counties. The health departments didn't get that money at all. So then the county commissioners determined how much they wanted to send the money to other municipalities, and of course that's a whole debacle. But it didn't, even though it's COVID related ARPA money, the health department didn't get much of that. I mean, did they even pay for the servers? I don't even think it paid for the $20,000 in the servers. So, just very interesting when you look at it from a high level. But so the carryover from 22 to 23 was $388,000. And then the carryover from the balance at the end of 23 was $254,000. So going in to 24, they had $254,000. I mean, that's when they hired Kirby and, they were kind of doing a push, and then all of a sudden the money all just disappeared. So that would be interesting. Like, how did they go from 254 to essentially nothing from January to December? I don't know. Definitely questions to have. So, and then right now they have with the $150,000 from the commissioners. I think they said they had like $189,000 as of last week. So, just something to look at. Now we do have environmental health. So here's a whole nother section, and I do hear a lot about this. Not all of it's very favorable. We do hear that it's very difficult to get sewer systems approved, septics approved. Sometimes food service licenses are very difficult and nitpicky. Sometimes it goes through quick for this person over here, and then it's a very laborious project for somebody over here, or you just don't get it at all. And so, that's a very controversial. Now you can't do, you got to follow the rules, when you're doing your inspections and things, but it is definitely a point of contention in our community, right? And that's just in passing. That's nothing that I've really heard that's new. That's just things over the years that you hear. So, and we certainly have a lot of nuisances in our communities that can fall to the health department. And so is the health department helping with those? Kind of how does that all play out? So let's get into some of the numbers for environmental health. We have total food service operation, retail food establishment inspections now this is for all of Hardin County, 279. Total vending inspections are 15, and that's like food trucks and stuff are inspected at their point of origin, so their county of origin. You may have a food truck come in that's from another county, that's theirs. This is just the 15 that are based out of Hardin County. Total mobile food establishment inspections, which is what I'm talking about, is 17. Total temporary food establishment inspections, temporary food establishment is 20. All right, so now we're going in. The total water samples collected are 69. I don't know where those are. Are those they're not at the water department, because we have, like Kenton at least has a sanitarium that does there, because you have to have all this training. So not sure where all the 69 water samples are collected. The total well permits, which would be new wells, are 43. Total sewage permits are 38. Total site inspections are 11. And pool inspections were 5. Now this is something I didn't know. The health department is kind of the keeper of animal bites reported. So like Musser got bit by a dog trying to contain a dog at a residence. And so that would be something that's reported. If you get bit, by a raccoon or somebody has bit you, or maybe your neighbor dog has bit somebody. They report that. So there was 78 animal bites that are reported, and some of that would come from like the police department, hospitals, other places where they say, hey, we have they're reporting to the health department. The health department collects it, and then they do a final report at the end of the year. So I still thought 78 was kind of a big number. Total campground inspections are 3. Now, total tattoo inspections, they're no longer here, but I asked about this because I said I didn't know. I guess there was a tattoo place in Ada for a little while. And then if you are like tattoo like your eyebrows or whatever, cosmetic tattooing, that's kind of a separate thing. That would be included in it, but I don't think we have any of those establishments right now. Like, we'll see when the new report comes out. And then total nuisance complaints received are 21. So this is hard for me to believe. I can probably tell you 21 nuisances off the top of my head. I know there's lots of them. And just because you received a complaint doesn't mean that nuisance was followed through and taken care of, because, for another day, another video, nuisances are extremely hard to deal with from a county perspective. And so I just think 21 is pretty low. That is an annual report. Sorry, this is a long video, but I thank you for sticking with me. And then in our next video, we're going to kind of talk about what's the future of our health department. I talked a little bit about it here, but in case you don't want to go the whole 20 minutes, you can watch this other video. So, all right, talk to you later.